Hi there, I'm Dr. Chung and welcome to your friendly proctologist. I'm so psyched that you decided to join the community. Thank you for your courageousness to click on this type of content. But really, we all struggle with these kinds of issues at some point in our life. And let's do some talking today about anal skincare, butt skincare, right? You got tons of cosmetics for the face, but how about the face of our bodies down where the sun don't shine, right? I mean, I think that there is more of a need for care of the skin. Why? Because it's so fragile. And that's what frustrates the heck out of us, is that it hasn't evolved to be tougher, like the skin on our knees and elbows, right? We can scrape and nudge things and it keeps up with all of us. And it keeps up with our kids for sure when they scrape themselves. But let's talk today about my suggestions on how to maintain the skin, how to protect the skin. What are my perspectives on different types of products? Let's first talk about some signs that you may see or notice that lets you know you might have an anal skin issue. Well, feelings of itchiness, burning, or sharp, tender wounds down your bottom end is a really big clue. How about when you dab your skin on the outside with tissue paper, you start to see some red blots of blood down there. And then you might also notice that it hurts to poop as well, but it's definitely on the outside of your anus versus feeling something on the inside. You might have also been taking selfie videos or even looking in a mirror at your bottom end and noticing that there may be some really small cracks, maybe some rug burn type wounds on your anus as well. Another thing that might be interesting is a white haze over your skin, right? It's normally a little bit darker pigmented, but you notice it's like a cloudiness over that skin, kind of like a callus over the skin of your palm. Another thing too is that you may notice the wrinkles on your anus are a bit raised, a bit thickened, and the folds, they kind of go down into the deep, dark depths, really like dark, deep canyons, because the skin has risen so high. And about these wounds, they can be different shapes and sizes. So they can be long and thin, they can be superficial, they can be deep, and of course they can have punched out little circles, or they can have a very large surface area as if someone took sandpaper and just rubbed the skin right off of you. Now, let's get into my professional opinion and tips on how to do anal skincare. Tip number 1 is please try not to put anything on your anus. That's right, no creams, no soaps or anything. Try to let the body figure it out for itself. The anus is a highly specialized area and extremely thin, dainty, and also very, very sensitive with tons of nerves there. But it's highly specialized. It has everything that it needs to self-regulate itself. But yeah, when I say don't use any soaps, I mean don't specifically put soap globs on your anus and try and scrub things off as if you're going to get all the bacteria off, okay? Because I'll tell you, you'll never, ever, ever be clean down there. There will always be bacteria constantly in the area. And yeah, other things like coconut oil or aloe vera. Not that I'm against putting things on there, but try to let your anus figure things out at first, because sometimes these substances, especially if you're putting them on for the first time, might be irritating without you even knowing it. Tip number 2 is to please be very gentle to the skin on your anus, okay? Be much more gentle than the skin on your face. And really, I mean, I've seen facials where people are scrubbing faces, picking pimples on people's faces. You do not want to do anything like that for the anus, okay? Please try to be contact-free as much as you can. In the United States, we're big fans of toilet paper. The toilet paper mafia has gotten a hold of us, or the wet wipe lobbyists. But even if it says it's the most softest, the most gentle, I don't care. Believe me, people have gotten into trouble by using these products and the skin starts to wear down. It starts to make cuts and sandpaper wounds. The best ideal thing is really the shower or using a bidet. How about a squeeze bottle from Amazon? Literally, it looks like a sports bottle with a nozzle on top, okay? Turn that upside down, squeeze it, and spray that water on your anus. So you do not need a really creative setup here, okay? Buy a $5 bottle at the store and put a nozzle on it, and you are good to go. Tip number 4 is protecting your skin from environmental factors like too much soilage from poop. And another thing is moisture, especially if you've just taken a shower and used a bunch of soap on there. So of course, a lot of contamination like poop has chemicals in it that can be irritating. Also, the texture of the poop as you're walking can get into wounds and also cause that type of itchiness that you get, right? And how do you know it is because of that? Because when you wash up, you instantly feel better, okay? Personally, I have run into that issue many times. What's with the moisture issue is a lot of it has to do with using soap in the shower right on the anus and robbing the skin of the natural oils. Those natural oils provide lubrication for your skin to slide past each other when you're walking. And you know the situation. Maybe you're sweaty, or maybe you just got out of the shower and that skin is so clean, so devoid or lack of oils that the skin starts to rub against each other like a rubber duck, okay? And the skin is kind of chafing each other and actually roughing itself up as you're walking. So what about some tips to protect your skin? Well, a lot of people are doing different things like using a blow dryer or a fan to blow and dry that skin off before they get on with their day. Or how about using a cotton ball or gauze pads? Put in between your butt cheeks and the air can flow through that and also absorb any moisture that may come up. Another tip is using Desitin cream or zinc oxide cream that can be long lasting and provides a lot of lubrication for the skin right outside their anus, right? Let's say you had to use soap. There was no other way of getting clean. Well, I don't want to have a rubber type of rubbing situation. Let's use a cream to try and provide a barrier over that skin. The next tip is for all of us that have a huge basket full of cream or whatever products, okay? So when we get an itching issue, we go to cream A. And then when that doesn't work so well, we go to cream B all the way to cream Z, okay? And I understand it. You know, we're going through each one because sometimes one works better than the other one day. But I'll tell you, sometimes the creams are not working, not because it's a different condition or problem, but because the skin is just rebelling against us helping it. It is not able to breathe, it feels suffocated, and that's why it's acting up. So try to give your skin a cream holiday every once in a while. Maybe a day once a week, maybe a half day where you've got nothing on it and the skin is just able to get some sunshine or get some air. The last tip, number 6, has to do with the very popular question, right? You get a product on Amazon or you get it off the pharmacy shelf and you're thinking,
gosh, wouldn't this thing that I put in the inside of my anus be great on the outside too? Or even the other way around, use a cream for the outside. I really want to try it on the inside. Will it be okay?
and I'll tell you, very likely it probably will be okay, all right? Yes, the anus is a very specialized place. Like I said, the outside of skin, the inside of the anus is like intestinal lining. But can you put a cream, even like a face lotion inside your anus? Yeah, of course you can. Can you put like any other oils or aloe vera, natural things in there? Yeah. People have put all sorts of things inside their anus and put it on the outside. And really, we're all gonna be okay. Just make sure when you apply it to the outside or the inside, be very careful, be very gentle, and try to avoid any trauma. Because yes, these structures are very, very sensitive and fragile. This next part, I kind of want to go over some broad categories of products we can use in our anus. Like number 1, creams, okay? There's a ton of creams, and what that means is that it has some water content in the product, right? Lotions have a lot more water, creams have a little bit less typically. And like the hemorrhoid creams, can you use it on the outside of your anus when you've got itching or inside? Yes, you can, but I'll tell you the one big con of these things, they don't last very long. You put it on in half an hour, it might be totally gone. So you may not be able to go to the bathroom and reapply, and therefore your skin kind of suffers. So for long-term relief, those kinds of creams probably aren't going to be the best solution. What about steroid creams? Yes, these can be extremely helpful, and there's different medications, different strengths. But for itching, oh my God, or some wounds, they can be extremely helpful and really help the skin to recover quickly. But be warned, okay, you should use these max 3 to 4 times a day per your doctor's advice, and don't use it more for 2 weeks if it's hydrocortisone, which is probably the most commonly prescribed medication for the fan of it because of the multi-use of this product for itching, for hemorrhoids, for anal fissures, and even for anal spasms, okay? But how it works is that it provides a nice barrier between your skin and fecal material and moisture, right? It's an effective barrier cream. It also goes on a little bit dry, okay? So because some of these creams, some of these heavier creams, like even Desitin, have a very thick, oily, pasty type of feel, and Pranicura doesn't. So it feels more airy. You get a little bit more comfort, and when you're moving around, you don't notice it as much. Another thing is the menthol sensation, okay? This menthol brings a cooling effect that can really calm your nerves, because if you've got that itching, the menthol in this cream can take it away. If you've got spasm pain or anal fissure pain, yes, this can also help it to go away. And the universal thing about it is that it can heal wounds, small and even anal fissures, and help with pain. So that's why I like it as an overall big player for treating your bottom end issues. Cream number 4 is Desitin. Yeah, the same one you use for your baby for diaper rash. And this is a heavy duty one because it is a very strong adherent material, okay? It binds very strongly to your skin. So if you've got a very big skin issue, rash, or wound or anything like that, this Desitin would be the first thing you would put on after you get out of the shower. So that way no moisture is on your skin, there isn't any poop on your skin, and you can get ultimate protection that lasts for hours and hours. Now be careful with this stuff, because if you put even more than just a finger-sized dot on there, okay? And then you start walking through your day, this stuff can get all over your underwear and all over your clothing, okay? And it can penetrate through your clothing as well. Ask me how I know, okay? So please use a very small dot of the stuff, put it in the center of your anus, and then it will, I promise you, it's gonna get all over the place. Definitely with all these creams, experiment a little bit first, you know, try in a little test area, make sure it doesn't take the paint off or damage your skin, and then, you know, give it a more fair trial and use it so that you can see if your skin gets better. And oh, what about oils? Well, they are extremely natural products, and they're very popular for use on the skin of the anus. They've got a very thin quality and texture to it, so it's easy to move around in, but it does tend to run all over the place a lot easier, right? Things like other creams like Desitin or Pranicura, they tend to kind of stay in place more, but the oils, they can kind of run down your legs, so you can't put that much on there is the thing. You can put them in suppository form, that's a very popular thing, and then allow them to melt, but again, kind of watch out for your clothing because it can kind of stain and kind of get a little bit uncontrolled as to where it ends up. So these tips and knowledge are the foundation of what I treat my patients with in my own office, and I'm being very, very genuine about that. For sure, there's a big spectrum as well, tiny little wounds, all the way up to big excoriations like burn wounds. Some of this stuff is really awful. It really can bring somebody down, bring their lives to a halt because of the pain or discomfort. Trust me, you're not the only one. I encourage all of you to share your experiences and your remedies in the comments below, okay? You know, I've been learning from you in terms of what people are using out there, and thank you for sharing that with me. I know that the community will want to know these tips as well. And like I said, a lot of this stuff is very safe to do. You can, because they're common products that we use on our bodies and our skin elsewhere. If you have any concerns, definitely check with your physician, dermatologist for their skin advice, proctologist, etc. And I want to give a shout out again to Pranicura. Thank you so much for being a sponsor of this channel. And I'm very thankful that your product works as well too. This is my go-to for itching. The menthol is really what helps me get through that minty flavor, I want to say, but it's a minty scent because I don't put this in my mouth. But that is what helps me get distracted, and get on with my day instead of having the burning urge to scratch myself. So go to their website, www.pranicura.com. I'll see you guys in the next one. Bye-bye.